welcome to Asake Online. My name is Zenzele Ndebele, and this is the Breakfast Club. Today in our program, we'll be talking to Michael Ndiweni, looking at how the informal traders have been affected by lockdown, and also, this is not the first time that the lockdown is the second time actually, and looking at the economy and how things are going. But as we start the program, we like to encourage people to say, as usual, we've seen that in this year, at the beginning of the year, a number of cases, we've lost relatives. I think all of us know someone who has died because of COVID. We know someone who's sick. We know someone who's in isolation. So we encourage people to, where possible, please try to stay at home. If you can't, we have to do business in town. I will encourage you to always wear a mask, sanitize, because this thing is real, and we all know that our health facilities are not able to hold or take a lot of people who are sick, but also, it's always a tall order to suffer from COVID, because, to start with, there is no medication. So you end up taking anything that someone tells you. I can assure you, if you have COVID and you are really down and someone tells you, you do it because it's painful. So please make sure you really, if possible, don't get COVID, because it's not fun having COVID. You are having something that that you might actually die from it, and that's the thought of saying, when you are down with COVID and you're looking at TV and you see the statistics, it's quite depressing. So the effects, we still don't know the long-term effects of people who suffer from COVID, but we know that some people, months after having recovered from COVID, they're still facing issues of fatigue, chest pains, shortness of breath, weak joints. And we really need to avoid. But talking to communities, I still find people who tell me that COVID, it's a theory. Guys, let's stop these things of 5G and Illuminati. COVID is there. It's a pandemic. It has happened before. We know of the 1918 influenza that killed a lot of people, and we also have another pandemic now, and we have to be very careful. Anyway, back to the program. Michael, welcome.
Thank you, Ndebele. Good morning to our viewers all over the world.
Yes, we have talked to Michael before, and he's the director of the Vendors Association. Is it association or initiative?
It's an association. It's an association of vendors, informal traders. Yeah.
Yeah. Also, you're also talking about the cross-border traders. So the first question to you is this is the second time that we've had lockdown at the beginning of the year. How has this affected your industry or your sector?
There's been serious ramifications of COVID-19 induced lockdown since the first lockdown last year in March. I think all are aware that Zimbabwean economy is predicated on the informal sector, the informal economy, over 70% based on empirical data from the IMF 2018, that about 70% of our population in Zimbabwe is in the informal sector, and our GDP is anchored on the informal sector. So the impact of the lockdown is not only to the traders, but also to the national economy at large. So there's been very serious impact that people were unable to buy food, buy medication, even to send kids to school. Some actually are supposed to be doing some private lessons, online education, and they can't be doing that now because they are not selling. So they are unable to raise money to pay for such facilities. So it has been very, very difficult for informal traders. And like you rightly put, that also the other group that has been affected has been informal cross-border traders, those that cross borders to either sell goods or buy goods out of the country. So there's been serious impact. At least some relief was then got when borders were opened in December, but now they've been closed. So the impact still continues, and worse off now that there's been an outright a closure of markets and then notified as a social service, and that means that people who have been surviving on trading have nothing right now on the table, or they have no money to buy food, and we are coming from a festive season, and if during festive season people expend the little they have because they need to buy gifts and goods and food for our families and for their friends. And people thought that then after the first they go back to the market and start working in the lockdown, and outright lockdown for that matter. So the situation is very dire for many households in the country.
Yeah, I know last year when there was a lockdown, there were lots of promises that were made by the Minister of Finance. I think I remember at one point they suggested that vendors were going to, or informal traders were going to get monies, and people were told to go and open accounts. I think it was Net One Lines. Did you ever receive that money?
The money came, but it was a paltry 600 RTGS. It came sometime in August, September, thereabout. It was 600 RTGS, having promised the money in end of March. So people had to wait for about how many months, if you can count, about 5 or so months for them to get the money. And it came once. And about 70% of our database, the names that we sent to government, they got the money. But it came only once, and people have been waiting for that long period. So it was very insignificant, to be honest, to get some RTGS. Then it was about $5 or $4, depending on the rate that you're using on the day. So it was very, very insignificant then, and it just came once, and that was it. So for me, I think that was very, very, very little to make any meaningful impact to vendors and informal traders and even informal cross-border traders.
Yeah, when we talk lockdowns, most of the times, business closing and economy closing, it usually hard hit. I mean, the people who are hard hit are the informal traders, because they're the ones who are selling out in the open, and you find that the lockdown orders, or statutory instrument will always specify that even vending is not allowed. In your view, how do you think these issues can be can be done better, so that vendors are not seriously affected, but at the same time, saving lives?
Yes, I would say what we did, not what we think could be done. What we did beginning of August 2020, working with other partners under the Zenzele consortium, funded by the Zimbabwe Resilience Building Fund, we were able to purchase materials like hand washing water dispensers, sanitizers, and masks. And then we actually distributed those to 22 markets here in Bulawayo. And what we did was then ensure that people who are getting into marketplaces, both food markets and other product markets, people are getting to be sanitized when they're getting to the markets. So what should be done is that there has to be mechanisms to ensure that traders go to work into their workstations in marketplaces, and there is then a mechanism to ensure that they observe the COVID-19 protocols like washing hands, masking up, and also adhering to the physical distancing. So what we had done is that we had hired or recruited people, what we called them market bailiffs, who were moving around markets, talking to people, raising awareness on the impact of COVID-19, and also ensuring that people are physical distancing, they're masking up, they're washing their hands. So that can be done. In our view, it worked, because if we moved around between March and December, you will see someone sitting at the entrance of a market, those enclosed markets, people entering, getting their hands washed, getting sanitized. You will see people masking up in marketplaces. So that can be done even now. So in my view, I think informal trading and allow markets that are enclosed and those licenses to go back to work, and then ensure that there are people who are monitoring the adherence to the protocols, and also use media to raise awareness. We are running programs on radio every fortnight from August up to the 10th of December. We're running programs on radios, talking to people, raising awareness, bringing in traders to speak to also to their counterparts on how they are actually conducting themselves in marketplaces. So this could be done. We think that outrightly banning trading is not a good thing to do. The government must engage associations like us, because we have the means to support and assist and complement them in terms of trying to reduce the virus.
What I find interesting is most of the times there is what they call the essential sectors. It's mainly manufacturing, maybe in agriculture, and they say, with the manufacturing sector, they don't close; they are exempted from closing. But you are talking about the World Bank report saying 75% of people in Zimbabwe depend on informal. Doesn't it make that the informal sector an essentially part of the economy?
It is an essential service because it is providing the goods that people are consuming every day. It is the economy of Zimbabwe. We cannot run away from that. We will be lying ourselves, Zenzele, if we say that traders are not providing essential services to communities because people buy from them. That is the economy of Zimbabwe. It is a fact. It is a fact. We have empty shelves in terms of industries in Bulawayo. Move around Belmont and see. Move around Donington and see. So people actually are trading in these small shops, in these small stores. That is the economy of Zimbabwe. Bulawayo City Council is getting revenue from these traders. Harare City Council is getting revenue from these traders. Any other city is actually getting money from these traders. So it is the economy. And right now, the government actually came forward, surprisingly. They said that they're introducing a presumptive tax of about $30 or so. They've seen that it is the economy. So then to say that economy is not essential, it doesn't make sense. So the government must reconsider the decision to outright ban trading and allow those with licenses, and like I said, work with associations to come up with mechanisms that will ensure that we also save lives as we do trading, like we have been doing for the past 5 months. It worked in some markets. It really worked.
I know last year issues of Bulawayo City Council relocating some of the informal traders from town to western suburbs, old markets. We really discussed about it, but we never found out what eventually happened. Did the plan ever work?
The plan, I say Bulawayo City Council has been very slow in terms of rolling out the decongestion process to ensure the adherence to physical and social distancing. Because if we are counting people, then it's very difficult to ensure that people don't spread the virus. So the idea was okay for them to move people to some townships, because it did ensure that people will have more spaces to trade on. So they've been very slow. So we engaged them, and what they told us was that they are lacking resources to set up new markets because they don't have money. So what we did then was that we actually bought paint and gave it to Bulawayo City Council as our small contribution for them to go and mark some markets. They did in some markets. So we think that they're very slow, but the idea of decongesting is very noble, because then it ensures that even people don't have to squeeze into some codes coming to town to buy goods. They can actually get these products in nearby bulk markets than having to queue into the Zupco buses and also expose themselves to contacting the virus. So the idea is okay to decongest, but the BCC has been very slow, but they were citing resources for them to be able to roll out that program. But if you go to Zenzele, some people moved to Zenzele, there's height of activity there. People actually are trading there. We're trading in town. So if you go to Ntumbane also, people who are trading there now, we're trading in town. So there are areas where people actually, even if you go to Highlanders Market at Masocha and 5 Street, people were at 5 Avenue moved to Highlanders. There's an activity there. So it worked to some extent, but I think more could be done. And I think that BCC has to find resources to ensure that this regime is fully implemented, in my view.
And the World Bank always talks about that. So that's the World Bank, but the World Health Organization says, for us to, for people to fight COVID, the most important issue is to test, to isolate, and to actually trace. I know in Zimbabwe that is a challenge to start with, because testing is US $60 if you are to do a PRC test, and that is difficult. But is there any formal way in your sector where people can maybe test every week or test then open up their markets? Has there been any discussion around those issues?
No, what we've done, there's no formal way that we know that the government has effectively communicated to us as associations. But what we've been doing, actually, we have said to government must ensure that testing is made affordable. Because if you're setting it at $60 for you to get the PCR certificate, many people will not afford that. That's a fact. But we have said this is known to government, that ensure that testing is affordable. Provide decentralized centers for testing, even in the townships. But now you hear that is one of the perhaps affluent hospitals doing it here in the CBD or outside the CBD in the affluent suburbs. So, but then if you go to the townships, there's no center whatsoever. People have to look for money to commit to that center and to go and also pay for the testing. But we've been saying to government, ensure that testing is made affordable to citizens. And this also causes the issue of people using illegal exit points to go to South Africa and other countries because they can't afford the PCR certificate system. So they have to go through Omanyamu to take them dinghies and go to these countries. It is because the testing cost is very high, and a lot of people, maybe now Zenzele will strike to pay $60 to get testing there, because $60 is also money. So in our view, the government must ensure that it has centers all over the townships, closer to the marketplaces, and get people tested. So if they could do that, it's one way also that could work to say, okay, open enclosed markets, but at least every week or every 4 days, go for testing, maybe at $1 or $2. It becomes reasonable. Because I don't know why it's $60 in Zimbabwe, and then in SA it's around 200, 300 rands. In other countries it's free. Why ours $60 US? Why? Maybe if I get that explanation, the cost that takes it to us, it makes sense. But right now, I don't understand why it is that expensive for Zimbabweans to get tested for COVID-19. And like you are saying, but it is what the World Health Organization is saying, that it is one way to try and then contain the spread, because you'll be knowing your status. But if you don't know, then how do you then protect yourself and other people next to you?
Yeah, one of the issues that also has come up during the COVID era is the issue of fake certificates. And people have always said, if people, those who want to go and order in South Africa, they think that $60 is quite a lot, and they end up buying fake certificates. But how does that then affect the fight against COVID?
It's simple. Someone will go to South Africa or will come into the country without getting tested properly, and then the virus, they will spread it. So if you are not tested properly and you just bought a fake certificate, it means that you don't know where your status. So you come here, interact with me, the next person, a group of people, and then you are the super spreader. So to use that term. So to avoid people using fake certificates, you need to make the testing cheaper. It's as simple as that. Let's make testing cheaper and also create more centers for testing. And then people will not go for a $10 fake certificate and try to cross the border. And unfortunately, some of these victims get their passport banished forever, prohibited to enter some of these countries when they discover that you are holding a fake certificate. Some end up crossing the Limpopo infested river because they can't even afford even the fake one. So they will prefer to use these dinghies, exposing their lives. And then some have died. I think you have reports that we have read that some people have drowned in Limpopo because the cost of the PCR certificate is high, and the people can't afford. So they then use these illegal exit or entry points. But you can only deal with that issue of fake certificates by making it cheaper, making it affordable, maybe subsidizing citizens somehow so that they get these services at least for free to some extent.
Yeah, so the current lockdown that we have is it will last up to the end of January, assuming that the cases are going to go down. But if it goes beyond January, what does that mean for the informal sector?
In my view, there will be chaos. There will be chaos, there will be loss of lives, because some people already, maybe they've defaulted, were supposed to buy medication because they don't have money. So there will be death. That is not recorded as COVID, but there will be death. People will die not because of COVID, but because of hunger-induced death and getting opportunistic infections because they're not getting proper food. So people will die. And some people will not be able even to send their kids to school. Should schools open sometime, wherever in March, wherever the case will be, they will not be having any cent to take the kids to school. And some will not be able to even to have their kids learning online as we speak, because some kids are already behind because their parents can't afford to get their kids learning online. So there will be chaos. And they were likely to see people going to trade illegally. I mean, breaching the restrictions, going to take chances. We were likely to see that if there are no serious measures being taken, co-created with associations and government to ensure that there's some kind of sanity in terms of how people do trading. Some people will start breaching the restrictions and going to trade, and you see a rise of human rights violations, getting beaten up, getting harassed, and we fear that could happen. So in our view, we think that it's high time right now we sit down with government, put our heads together, because we have the solutions, we have ideas that we think can work, that we can jointly pursue together, and they will save both us and also the other side, the supply side. So if nothing is done, Zenzele, and the lockdown is extended beyond end of this month, there will be chaos.
Yeah,
there will be chaos.
You talk about, having ideas and sitting down with government, but is there an opportunity? Are there avenues where you can actually engage government on these issues?
There are opportunities. We tried last week. I think it was a day or two after the outright lockdown was announced. We used our contacts to try and suggest how things can be done. I think you saw there was an amendment that came saying that traders who are in food products can go and trade, and they gave the parameters. They even sent us the new format of one applying to get exempted. So there were movements to some extent, but it's not what we wanted. But after we made some interventions through our networks in some government officials, some strategic partners that we work with, we were able to get something, but it's not fully what we wanted. Say, for instance, people with who are selling agricultural products were kind of allowed to go and open their markets, but through some strict kind of conditions. But initially, if you check the initial lockdown restrictions, it was not stated. But then there was an amendment. So we think that if you continue with advocacy, things could be improved, because we still believe that Zenzele, enclosed markets, those with licenses can trade, and we think that there is a way to support them to deal with the cost of compliance and provide sanitizers somehow through working partners and water dispensers, pocket wash hands. We can still try to contain the product virus in the marketplaces. So we think that is still possible, and we think that, like I said, there are things that we've been using. We've been talking to portfolio committees on SMEs. We've been talking to other members of the PAC. We've been trying to identify strategic people that can engage in other economies to try and say knock sense to some of these officials, say no, but this is not going to work. We need to try and pursue some of these avenues. So there was that kind of an amendment, but it's not fully what we wanted. So I'm still trying to push and see how things can unfold as we move forward.
Thank you very much, Michael. That was Michael Ndiweni, the director of Bulawayo Vendors and Traders Association, talking to us about the challenges and hopes and opportunities that the traders have. But we're looking at the challenges that the vendors and traders are having during this lockdown. We know the lockdown is not only affecting the vendors, but almost the whole economy and everyone. But with most of the people in Zimbabwe depending on selling in the streets, ordering and from other countries or buying commodities from other countries, it becomes difficult to operate when the borders are closed. But Michael, maybe before you go, assuming that yes, we come up with these opportunities and may agree with government that to say people can trade, but how are they going to operate when the borders are closed and they're not getting their wares from other countries?
Interesting. That's a good question, actually. I like your thinking towards the end. So I will start by saying something that you didn't ask. Our view is that there has to be balance between enforcement and livelihood in this case, in the COVID-19 induced lockdowns. So there has to be enforcement of compliance to COVID-19 protocol, but also let's think about the livelihood issues. That are very, very important. I felt that I should say that to whoever is going to be watching this program. But your question in terms of where are they going to get the commodities? So what we did as BVTA, to be specific, in the first lockdown in March, we put people in clusters to say those who are into food production, those who are into garment production, those who are into detergents production, you can come together. Then we can provide people to train you, give you skills for you to be able to produce some of these goods locally. So what is happening is that vendors are actually producing goods, quality products for that matter, and some of them you see them in the shops. So we need to support those groups to produce in their backyard factories, so to speak. So that is the way we can do to ensure that people consume locally produced goods. So we need to support vendors to produce garments, to produce food, to produce other materials. So we don't have to rely on going to sell things in South Africa. And as a matter of fact, also, that traders were not going to SA or Botswana, Zambia, Mozambique, or Dubai to only buy goods. Some go there to sell locally produced goods. And I think there's been a misconception that we're going there to buy and flood Zimbabwe. Some take goods here. We have members who go to Botswana with clothes to go and sell locally produced goods, quality goods for that matter. So we need to support local production. This is the opportunity now. So that's the new normal. That's a shift to say, instead of saying we're going to order goods, let's say Botswana, produce locally, support those backyard firms, backyard groups to produce goods locally and feed into the market. So there is a way, Zenzele, where things can work. We are not saying selling in markets is the only way, but also you can produce and compete with some of these well-established multinational corporations that produce goods. And we help traders with the branding, reach the market. We can do that. And we've been trying to do that over the years, since last year in March. And it's working. It is working.
Yeah, thank you very much for that point, because what it means basically is that we are not also, I mean, while the lockdown is a problem, but it's also an opportunity. It's not only solutions that are going to make people produce local, but also, lockdowns, when borders are closed, they need to force the local production to go up, local industries to produce their own goods, as they cannot be able to go to other countries to actually order. So we hope that you're going to be able to engage the government, and the traders are going to be back somehow or in some form in the streets, or it's selling. It might not be in the streets, but they might be back somewhere selling. We do hope
online.
There is the opportunities to make business, because lockdown has allowed us to think in other terms. So thank you once again, Michael, for this enlightening program. My name is Zenzele Ndebele, and this was the Breakfast Club. And today we're talking to Michael Ndiweni, who's the Executive Director of the Bulawayo Vendors and Traders Association. We're talking about the lockdown. So if you also have other interesting issues that you want us to discuss about, please do get in touch. We are on Facebook, site CITZW. We are on Twitter. We are on Instagram. We are on YouTube. We are on Telegram. We are on WhatsApp. You can find us on all these platforms, also on a website. So please do get in touch and share with us. So from me, Zenzele Ndebele, till we meet again tomorrow, have a good day. And tomorrow we are talking about rural economies. So we'll be talking to someone from the Institute of Rural Technologies to try and find out what rural areas are doing and what are the opportunities for rural economies, because we can't always be talking about urban areas as if there's nothing that exists in rural areas. So from me, Zenzele Ndebele, have a good day.